Beauty. Is it a line? A shape? A formula? How can science and medical innovations redraw a new world of beauty? Since 1978, FILLMED has drawn and created new territories. For the first time, we put emphasis not only on wrinkles, but on skin quality with the NCTF, a unique formula based on hyaluronic acid, CE marked in 2006. Since then, NCTF became a must and is often used in aesthetic protocols. In 2014, FILLMED created a new formula with trihyal technology, associating 3 types of hyaluronic acid. This gave integrated skincare with skin perfusion to complete aesthetic procedures. Always concerned with women's expectations, we conducted a survey based on the Rosenberg scale to ascertain the impact of dermal filling on self-esteem. This was a first. In 2019, we innovated once again with NanoSoft, a new experience of injection, the smallest needle on the market. Today, we enter the era of positive pro-aging to put time on your side. Let's draw a new chapter.
Well, good morning, everyone, and thank you for joining us on this lovely, well, getting better Monday, bank holiday Monday morning. Let me just get my next slide up. Sorry, I'm just having to let more people in. More people are joining us a little bit later, so good morning all. Right, first of all, we've got the wonderful Andrew Hansford today talking to us about hair restoration, which I think we'll all agree is a topic that doesn't really get much attention in our world, but it is incredibly, incredibly important. So first of all, I just want to highlight right now the aim and objectives of today's session. So for the next 45 minutes, you're going to have Andrew Hansford talking to you about hair restoration in combination with NCTF, which is our hero product at FILLMED. So really just to reiterate that this is not a training session, although there will be lots of hot tips and probably it will just get you excited wanting to join us on some physical training once we're out of this lockdown. But this is not a training session. It's not intended to be a training session, but it is designed to sort of open your eyes and help discover the wonders of working in partnership with FILLMED moving forward. So first of all, I just want to talk you through how to get the best out of this program Zoom that we're working with, because I've had to become a little bit of an expert in this technology, although I'm probably going to make a few mistakes today, so you'll have to bear with me. So how this all works, you can ask us anything you like as we go through. Use the chat function at the end on Zoom, and I will ask Andrew, who's our expert for the day, the questions at the end. The way to find the chat is just via this little speech bubble at the bottom. And can I just ask you all to mute your microphones as well as we go through, just because we do get a lot of feedback and noise if everybody's microphones are on. But if you want to use the chat function as we go through to ask any questions, I will save them all to the end to ask Andrew, and hopefully we'll get through as many as we possibly can. The best way to use the screen as well, I've found, is that if you want to just hover your mouse over the green section at the top where it says view options next to it in black, and reduce the size of your screen down to 50%, it will allow you to have a presentation slightly smaller, and then you'll get the lovely picture of Andrew that will appear in the top corner as well. If you use this little icon, you can flip between Andrew's camera and the presentation. So if you're finding Andrew more interesting than the slides, then you can get him full screen. Just going to take a little opportunity to introduce my team here. So I'm Rebecca. You'll see my face very shortly, but I'm the UK director. I've been working with FILLMED for about 4 years now. And then we've just recruited the lovely Amy Williams and Jennifer Kinney, who are our regional account managers in the north and south of the country. And we've also got Liz Bell. She's our customer service and administrator. So you won't see much of Liz unless you actually attend our conferences, but you'll certainly hear from her over email and always available to speak on the phone. Now, we're very lucky to have a fantastic expert panel. We had our first FILLMED forum on Friday where everyone was invited to come along and ask our expert panel questions. So we've got our lovely Debbie Rainbow and Dr. Philippe Hamida-Pazal. They work on our injectable side and approach treatments and protocols from a very medical standpoint for our medical practitioners, so including things like art filler and our combination protocols that combine NCTF as well with filler. Then we've got the amazing Andrew Hansford, who's speaking today, and he is Mr. Skin. There isn't anything this guy doesn't know about skin, so I hope you've got lots of questions ready. And then we also work with the lovely Jason Gale, who's a communications and marketing expert. He's done a forum already for us this month on how we can keep our business communications going to our patients, but he's also got another session at the end of the month talking about how we can start to get our businesses ready for reopening, which is very exciting. So most of all, we're here to help you, we're here for you, so get your questions ready, get your pens and papers ready. I hope you've got a nice big cup of coffee, and without further ado, I'd like to welcome Andrew Hansford.
Hello everybody, happy Easter at this very strange time. I hope you're all having a lovely Easter and enjoying yourselves. Let me know if this is working, Bex.
Do you want to just, yeah, there you go, perfect.
There you go. Okay, so as Bex, thank you very much. As Bex just said, we're going to talk about hair restoration utilizing the Hero NCTF 1 through 5 HA. Oh, why does it say 1 through 4? As we discussed, this isn't a training thing, and it's actually one of the most difficult ones I have to talk about because it is very, very complex and it has a physiological impact too. So I really want to make sure that we cover that as well as anything else, because we need to make sure that we are so heavy on patient care and making sure that we give the right advice, even if we're not scalp surgeons or trichologists. I studied trichology 100 years ago, and it fascinated me, I have to say. And it's weird that it's come round full circle 20 years later, and I've stepped back into it again. But at the time, it worried me, it made me nervous because of the fact there's so many things out there that people are told about, and a lot of it isn't actually correct. So from the physiological impact of hair loss, we have a variety of negative repercussions for individuals' psychological well-being, quality of life. Absolutely. It is apparent that hair loss causes dramatic and devastating emotions in patients, which can negatively impact their self-esteem, body image, and self-confidence. And many men feel isolated and have fears of being considered vain if they openly admit being unhappy with their hair loss. We see that one a lot. For many cancer patients, losing their hair is very traumatic, and in actual fact, some women have described it harder than losing a breast. Some patients have reported the hair loss negatively affected their social activities and interaction, and changing in self-perception and self-esteem, and decreases in sensuality and sexuality will be felt to be related to hair loss. And hair loss may be distressing for women, perhaps because a woman's hair is regarded as an indicator of personality, attractiveness, sexuality, and obviously femininity. And this one's quite impressive, that last year, the second most researched cosmetic treatment for men was hair transplant. So we know it's a big thing, and we need to make sure that we address that from a psychological perspective, not just, you know, oh, we can do it, and because you can't necessarily. It's a complicated process, and if you come on training, obviously we're going to expand this exponentially and get really into the nitty-gritty of it all. But the basics of it are the causes. We have alopecia, we have male pattern baldness, we have female pattern baldness, hypothyroidism, that's a hard word to say, thyroid, chemical treatments as in chemotherapy, medication, physical stress, and emotional. There's a lot of them. Now we're treating. I'm not going to stand here and say to you that we are using this particular product to regrow hair. That also doesn't make sense ethically, technically. It's the same thing when we're talking about skin. We are maintaining the skin's health which if the skin is healthy, all of the good things, all the bad things, sorry, that we are experiencing will stop. Exactly the same as hair. We are addressing the scalp quality and making sure that the scalp is at its best possible ecosystem and working perfectly to maintain or regrow. It's not a, this can do this. We have to look at the broader spectrum, the broader picture. Now, scalp aging is exactly the same as skin aging, okay? So we're treating it the same way. So environmentally damaged skin can also be classified for hair too. The environmental effects are cumulative, so it's consistent. So we're talking more about sun and UV here. You tend to see a lot of hair loss with people who sunbathe a lot. Guys who work on construction sites, etc. Bam, 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 it's environmental damage. There's also concern with free radical damage. It's not a concern, it's true. So with the imbalances, we have stress, we have physiological or psychological trauma, we have inherited traits, we have blood circulation, we have nutrition, we have medication, hormone imbalances, severe illness. So we're looking at a lot of things here that we have to address before we even start thinking about treatment. Now, oxidative stress, like certain medications, pollutions, tobacco, there's massive study in relationship to tobacco and smoking and hair loss. Emotional stress, inflammation of the skin or perifollicular inflammation, so that's when the skin gets very angry. This will result in cell death, okay? Now, this is the same thing for the scalp as it is for the skin on the face. Now, there's a wonderful product that has huge evidence behind it, glutathione. And glutathione is the core, the principal defense mechanism of the cell. It defends the cell. It stops it as much as humanly possible from dying. Therefore, it's an excellent choice in this case. Now, the scalp disorders we're looking at, normally, there's many of them, but we have alopecia areata, okay? That's the one that gives that glossy, waxy finish. You usually see it quite a lot around behind the ear down here, but it can go anywhere. It's a bizarre one because we're not completely sure what happens. Is it stress? Is it trauma? Quite possibly. But when you look at the actual area of hair loss, it's smooth and there's not a follicle inside. Then all of a sudden, boom, the hair starts growing back again. We don't know why. With mesotherapy, alopecia areata has had some really good results. We'll get to that in a second. Alopecia totalis is full hair loss. Now, you can't treat these people. But unfortunately, I do see a lot of people who say they can. You can only treat hair loss if there is an active follicle or a follicle, and you can help activate it possibly. If the follicle is missing, it can't happen, end of. So it's really, again, down to you to be honest, completely honest, and don't give false promises. Alopecia diffuse is the one we see the most of, and that is where the hair falls out everywhere, throughout the scalp anyway. It means that the hair entering telogen results in accelerated hair loss. So it's basically calming down. It's not working as good as it can. It can be short-term and it can be corrected in this situation. And then alopecia traction. And this is getting more so in actual fact. And this is people who have hair extensions, braiding incredibly tight, pulling on the scalp far too much. And over a period of time, you will get extreme hair loss. Now, male pattern baldness is incredibly complicated, so I'm not going to get into it massively so. But it has an intrinsic, of course, which is genetic, and it has extrinsic, which is environmental, and it has oxidative, which is stress. So once again, we're going back to the same scenario as skin health or facial. DHT, dihydrotestosterone, is the main drug in this situation, and it's the one that is implicated in male pattern baldness, and it's based on testosterone. So you do tend to see guys who have overt testosterone. And again, this isn't a rule of thumb here. It just seems to be this way, and it would make sense due to the hormone testosterone. Guys who work out excessively to a point of crazy tend to have hair loss. It's more extreme. So again, we're looking at the client face to face and going, is it genetic? Okay, so is it brought on by hereditary traits by either parent? That's an easy question to ask. Male hormones. what's going on with that? You know, can you tell that it's a hormone related scenario? It will tend to be more hormone related if it's universal, as opposed to just the hereditary, which tends to be here and here, and age, of course. If someone's starting to lose their hair very, very young, I'm not saying that you can't help at this point, but it's a definite trait that it could be a genetic standpoint coming from that. But we need to maintain it. And with guys, it's difficult because they are a bit rubbish. I can't tell you the amount of people who guys have said to me, well, I'm losing my hair, so I'm just not touching it, just leave it alone, you know, which is the worst thing you can do. The number one thing you can do in any respiratory protocols is getting big, you know, paddle brushes, squishy paddle brushes, stimulate. But they think that's the opposite. They think that if they do that, the hair's going to fall out. It's going to fall out anyway. But you need to stimulate that blood supply to the papilla, and that's the number one thing, which is what minoxidil does. Female pattern baldness, it's completely different, because we know that most of the time it's hereditary. Yes, there's an aging situation here, and there's also changes in hormones. So if a woman tends to have quite excessive hair loss, then we know that their androgens, the male hormone, is higher. So they could almost go and see a doctor to get hormone tests to find out where that's coming from. Certain skin diseases can do it too, of course, because they can lead to scarring of the hair follicle. Certain autoimmune hormone problems, such as too much testosterone, too little iron, too little bit vitamin B, medications such as chemotherapy and beta blockers, alopecia areata can happen, and temporary shedding of the hair after major illness, surgery, or pregnancy. So you can already see that there's a ton of things that we have to take into consideration here before we even start treatment. Now, we all know this, I'm sure, but the hair itself is an amazing piece of kit. It's the same with the skin. It's hard keratin as opposed to soft. And I'm sure you're aware too that you can do some amazing testing on the hair. If you pluck up someone's hair and get it tested, you can tell what drugs they were on. You can tell all sorts of things, what they're deficient in. It's pretty incredible. So there are areas a little bit like the skin. The cuticle we're not too bothered about. That's the outside layer. It's a bit like fish scales. The cortex is the most important. That's the bulk of the hair shaft, and it gives it its strength and pliability, elasticity, etc. Then we have the medulla, which is a central core, and to be honest with you, no one's really sure why we have that. You don't tend to have it in very, very, very blonde people, or in African American don't have it either, but we're not really worried about that particularly. The follicle itself, we are. It's bizarre in the fact that it's the only organ in the body that renews itself cyclically, so it's consistent, and there are 3 layers that surround it. You have the outer root sheath that surrounds the follicle and separates it from the dermal tissue. You have the inner root sheath, which is made of the hair's cuticle, and the hair bulb itself. So the hair bulb itself is where all of this good stuff's happening. It's where it's being fed as it starts to grow. The follicle, as it leaves the scalp, which is a random one, this is something I learned a very long time ago. It's almost like a V. And this amazing trichologist said to me once, you can actually strangle your hair. And I was like, really? That's weird. And it's basically down to maintenance, which I picked up earlier. So yes, we have all these genetic traits and various other things, but there's also the maintenance is so incredibly important. So if you have this V and the hair comes out, it has a 360 degree of movement, or should. But of course, oil, sebum, skin gets caught inside that. And if you don't brush your hair to lift all of that out. And that's why the hairdressers tell you to wash your hair twice. I'm not sure if they realize that's why, but that really is the reason why. To get all of that stuff out, it allows free movement of that hair again. And they said that by clogging that can actually suffocate the hair. So again, maintenance is very, very important, as well as what we are doing. So the growth phases, which is the most important in all of this, for those of you who have done things like laser or IPL hair removal will totally understand this, that you can only kill the hair in anagen phase. So in anagen, the hair is categorized as growing. So we've got between 2 and 7 years. It changes dependent on the body. The head actually is, if someone wants to have IPL on their head, they'd be laughing, because it's the hair that's in the most anagen. Catagen is when it's transitory. which is only a week or two, and then telogen, it's in its resting phase. Now, in its resting phase can last up to 3 months. Now, in that situation, the hair's resting, it's having a bit of a nap. Now, if you don't wake it up, it can just give up, which is why the consistency of stimulation, and one of the reasons why things like minoxidil work, is because it's consistently stimulating the scalp, bringing the blood flow to the scalp, which it doesn't like doing particularly, and can help bring it back from telogen into anagen. And that's what we want. Anything that's in anagen, we can work with. The chemistry is basically blood, all right? So at the end of the base of the papilla, our blood vessels, capillaries, that provide all of the nutrients to support the birth of new cells, which will then turn into a hair. Blood can calm down for lots and lots of reasons. It can be reduced for lots and lots of reasons, and also it's a very long way up. So when you see a baby's scalp, it's all baby pink and beautiful. If you look at our scalp, it's completely white, almost grey. But if you scrub it with a brush, it goes all nice and pink, and you see the blood circulation. So we want good blood circulation. We want hormone, nutrition, hormone balances, hereditary factors, and health. I've already mentioned that. Okay, so we're checking all of those different things to make sure that we're on the right track. Growth factors are also very important. In fact, they're pretty much everything. One of the big growth factors that we're all aware of is PRP. It has become all famous and fabulous over the recent years. Now, again, I'm not going to go into this massively, but there are around 7 forms of hair loss technically, and one of them is trauma related. And that's the one where PRP has had some incredibly good and very strong success stories, because what does PRP do? It is there to help wound healing. So it makes perfect sense that if you're causing a trauma with a condition that's created by trauma, you're going to help to restore that. The other forms of hair loss, not quite so much. But with the growth factors, we need to understand that we need to kickstart these guys. And this goes back to what I said right at the beginning about making sure the maintenance of the extracellular matrix or the scalp is optimum. So with platelet-derived growth factor is hair canal formation. Vasculoendothelial is improved follicle vascularization. Epidermal growth factor is regression of the hair follicle. Insulin growth factor slows down cell death. Fibroblast growth factor, promotes the anagen stage, and nerve growth factor is reception interaction. So all of them have a massive part to play in the maintenance and regeneration of the hair. Now, we can't implant any of those things, but what we can do, they're in us inherently. We need to make sure they're happy and content, technically. So the extracellular matrix, which is just the coolest thing ever, and the most maligned in a lot of ways, is the body's ecosystem. It's the body's, it's where all the good stuff is. You know, we see it visually when we have collagen and elastin loss. As we get old, we have the downregulation of collagen 1 and collagen 3. It's where the oxidation damage and breakdown of the matrix can happen through sun, which is DNA damage. And it forms the essential structure of the cells. It controls communication between cells. So technically, it's pretty good, all right? Now, inside all of that are the good things. So when we're looking at regenerative aesthetics and skin aging, we're focusing on things like fibroblast and hyaluronic acid, etc., etc. In hair, we're kind of thinking the same thing, but the hair sits in there too. So we want to make sure that that is happy and the follicle is happy, the blood supply is happy, that everything's going on. So think of it this way. So this is my silly analogy. It's a fish tank, a tropical fish tank, all right? Think of this as the extracellular matrix. There's a bucket load of stuff going on in here. The fish, the plants, the life in it, in the fish tank is huge. So think of the surface as a stratum corneum, and we're not bothered about that. The tank bottom, we're not fat, so we're not worried about that. In the central point, the extracellular matrix itself is where all of the good stuff happens, whether it's skin or whether it's scalp, all right? So just think of the enormous amount of life that we just stated in this fish tank, the ecosystem or our matrix. What happens if this tank's pH changes dramatically? Most of it won't survive. And you know, that's makes sense. So maintenance of the extracellular matrix is mandatory to keep our own ecosystem functioning correctly. So that's where the mesotherapy steps in, because whether we're doing it for scalp maintenance or whether we're doing it for skin maintenance, to maintain our extracellular matrix means that all of those things are going to happen naturally. And we'll explain in a second the various ingredients that relate to the hair. There are ingredients that relate to acne and to pigmentation and to collagen induction that sit inside this vial of NCTF. Now, the risk factors that you'll be doing, this is more in consultation technically. So ask all of these questions, or because it will make sense. Family history, great. Advanced age, physical stress, medication, pregnancy, use of aggressive hair styling products, that can happen a lot. Poor nutrition, rapid weight loss, restrictive weight loss, like low carbohydrate, fat, etc. Tick box these guys, so you can kind of figure out, you know, what's going on. Diagnostics, huge, 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 huge. Number one, sit that client down and have a full-on consultation. Weirdly enough, this is not weirdly, but this is one of the longest consultations I would ever do, considering all the others. Okay, so you need to ask these questions. So their clinical history, whether it's drug intake, systemic illness, weight loss, recent surgery, general anesthesia, hormonal diseases, gynecological history in women, family history, iron levels, vitamin levels, physical exam. Is it alopecia, diffuse, or is it patchy? Look at the color of the scalp, the presence and distribution of hair follicles. How far apart are they? Scaling of the scalp, evidence of scarring, hair density, and severe hair shedding. Clearly, there's a lot to take in, isn't there? To look at all of these things, but it means that you're going to get a much better way of dealing with that client. Like I said earlier, that is so important that you don't give false promise, and to be able to help them in the best way possible. Now, if you're looking at this, I happen to have myself, and it's really cool. They're not massively expensive. You can have a look. It's wonderful for lots of different reasons, because you can get to see, and the client can see in front of you. Now, the scalp on the left is showing the blood supply to the scalp. It's mind-blowing. It's brilliant. You have two hairs growing out of the same follicle, which is perfect. On the right-hand side, you've got hair density, so you can see the density of each hair strand individually. So it gives you a good response from that. The left one is the health of the scalp, as is the right. So its keratization is the right, but you can tell the difference between the two. The left is very tight. Still good hair growth with that, absolutely, but it's very tight, where the right is not. Now, mesotherapy in hair loss is pretty cool, because it has lots and lots of evidence now based on it. It's been used for a very long time, but it's not PR'd massively. So it shows a very strong therapeutic weapon against androgenic alopecia in men and women, when functioning follicles are present. Remember that. You have to have a functioning follicle, or at least hair there. We look at hair loss in the same vein as aging processes of the skin. So it's logical to use a cocktail of ingredients targeting skin and scalp aging. Targeting the cellular aging of the hair follicle, antioxidants on contact with dermal cells stimulate cellular metabolism and hydration. Yes, absolutely. So what are we looking for? No further hair loss, regrowth, or increase in density and quality of hair. That's what we're looking for. So why are we choosing NCTF? Okay, NCTF has got various papers, lots and lots of papers, in actual fact, clinical studies. And this is one of the studies that was done on hair loss in relationship to alopecia. I've read this inside and out. You're more than welcome to read it too. It's very informative, actually, and really interesting. But the NCTF product itself has 59 ingredients. So 24 amino acids, 12 vitamins, 6 coenzymes, 6 minerals, and glutathione, and hyaluronic acid, of course. So it's got it all inside that. It was made over 40 years ago and hasn't changed since inception. So we got it right at the beginning. Everything within this cocktail of ingredients is at the highest quality. So we know that we've got a safety profile. It's CE registered. So we have the full-on safety profile and know that we can do as good as we possibly can. You've already seen that. So that's part of the study to the right there. So treating alopecia mesotherapy, we aim to prevent the catagen stage and extend the anagen stage, okay, by introducing protective molecules and antioxidants into the matrix. So back to what I said earlier, keeping that fish tank and that ecosystem ever so happy. Now, NCTF, we know, contains ingredients that maintain the skin's integrity. So why can't it not maintain the scalp's integrity as well? So the ones we know about and have a lot of evidence behind them is B7, which is biotin. People use that. You can buy it over the counter. I think it's actually called hair and scalp or nails or something. Folic acid are important due to their involvement in the renewal process of the hair follicle and the formation of keratin, which is hair. Vitamin E and vitamin B3 has a localized vasodilatory effect. It's a really hard word to say. And vasodilation, amazing. We love that. And glutathione, okay, this is the baby. So it has 3 antioxidants, glycine, cysteine, and glutamate. So it is the principal defense mechanism of the cell, protecting the follicle from oxidative stress and microvascularization. So it's protecting the scalp, protecting the hair from all of those oxidative stresses, smoking, drinking, sun. It reinforces the antioxidant action of vitamin C and E. It also depletes with age, doesn't everything? And the protection starts to stop. It also acts as a signal to other metabolic processes, which is really mad. The other part of the study was LED. Now, this made perfect sense to me because we've got a double whammy happening here. So you're implanting the product into the extracellular matrix to allow it all to be happy and content and just gorgeous. But we want a little bit more of a kick. So LED has been around for a very long time, as we know. It has lots of evidence on certain points, especially blue and red. It's a photobiostimulation, okay? It goes a lot deeper. So it helps with mitochondrial cell activation. Oh, I'm sorry, Rebecca, I was supposed to put a Duracell bunny here. The mitochondria, without going into a big one, as I'm sure you're aware, is the powerhouse of the cell. It's the Duracell battery, hence why I was meant to put a Duracell bunny in that point. So if that's happy, we're laughing because it's that Duracell battery is working consistently, and that's what LED does. It kickstarts mitochondrial activity. And in that situation, it transforms the protons into ATP, which ATP is the energy source of the cell. Now, with LED, it definitely helps cellular function of fibroblasts. It increases collagen synthesis, improves microcirculation, increases ATP. And anti-inflammatory helps in normalizing sebum production and reducing hyperkeratosis. So again, clinical evidence behind that, clinical evidence behind mesotherapy, put the two together, you're kind of having a lovely time. So the treatment itself, again, I'm banging on about this, but you be prepared, okay? Make sure you thoroughly explain to your client that this is not a guarantee. Hair restoration or maintenance is difficult. It holds no guarantees. I always treat it like it's hormonal. And if you're completely 100% honest, they will probably say, yes, let's give it a go. If you haven't, if you're not honest, you're giving them false hope. And as I said, this is such a psychological condition that you really don't want to go down that road. It's up to you to explain in detail and act accordingly. If you believe it's a surgical case, have a surgeon on hand who you can actually send to for consultation. You know, it's not about losing clients here. It's about hand-holding them through the entire process and coming out the other side. If you have a really good surgeon, and I know quite a few of them, who will use mesotherapy pre and post hair transplant because they know it helps. An honest approach is the best way. As I said, false promises never work. So, like I've said, we're not technically treating hair loss here. We are treating the scalp health. And I know I've said it a few times now, but I want to bang it home because that really is what it's all about. The whole emphasis behind mesotherapy is skin health. If you've got the best quality, healthy skin, then you will absolutely help with rosacea and acne and pigmentation and dehydration, all the variances. So we're doing the same thing with the scalp. We're maintaining its health to maintain the few things it's capable of doing, one of which is hair growth. by which maintaining the extracellular matrix ecosystem and status quo. We aid in development of hair growth and its maintenance. Now, the treatment is relatively simple. Take images of the scalp for your benefit as well as the client's, because obviously, again, we're looking at a psychological perspective here. You want to be able to see what is happening in front of you. You can actually, the little machine I have, you don't need to necessarily have that. You can get one of those oogie-madoogis that fit to your phone, your camera phone, which can make the picture look bigger. It doesn't have to be as big as that one, as long as you get to see something. And it keeps records accurately, of course, so you can look back before and after. And I'll get to something in a minute, which is quite amazing. Using a roller is easier because it's less time consuming. It was usually done with a needle, quite a deep depth in actual fact, and we've never realized that that isn't the case. So we look at a roller of about 5 mil. This will cause stimulation, of course. It will create multi-punctures for better penetration and improve blood circulation. And also causing a wound will help with one of the hair loss protocols, which is traumatic response. However, now with FILLMED being amazing, they've created this little guy, my favorite, the NanoSoft. So you can target with this. So you can use a roller if you want to, but you can also use a NanoSoft device, which is a microneedling device too. So it's got 3 needles, so you're causing the trauma as well, and implantation of the product quite very easily. The scalp is can be quite uncomfortable. You can't anesthetize it really. And you wouldn't want to, because you need blood. And what does anesthesia do? It's a vasoconstrictor. You don't want to want that at all. So both of these options isn't painful. So the NanoSoft is 3 hypodermic needles, which means that the product flows through the needle into the scalp. It's not just needles that puncture. So you're going to get perfect application each and every time. There's no pain or minimal pain. There's very little trauma. Perfect placement. It's a medical device and it's got a CE marking. So you have the option of both. I use both. So in treatment itself, your option is the glory of NCTF and your roller, or NCTF and the NanoSoft. Now, the timing on this is around 6 sessions every 15 days for 3 months, followed by 5 sessions once a month for 5 months, and then maintenance. Now, that sounds like a really long time, but to be honest, it doesn't always happen that way. What I always say to them is, because we have a certain amount of the hair that's in anagen at any given time, you will be able to see if there's a response in 2 sessions. You'll be able to tell. So that's, again, saying to them, okay, you don't have to sign up for like 11 sessions. And then at the end of those 11 sessions, we're going to see what's happening. No, you'll see it much quicker than that. You'll see the hair of the scalp, the structure of the scalp changing. You'll see the blood supply. You'll see it's healthier. You'll see new hair growth, possibly. You may see vellus hair. And you'll see the structure of the hair that's there changing. So that's in the first couple of treatments. And I'll get to a picture of that to show you. So it's a total of 11 sessions. As I said, it's client dependent, and you'll see it after 2. But also explain the importance of maintenance. So you don't want to do all of this work and they go home and like, don't wash it, don't wash it. No, wash it. Stimulate with a paddy brush. You don't want to scratch the scalp. You want to stimulate it without hurting it. Just a random one. Have you ever said to someone, brush their hair like the opposite direction, and they're like, no, it really hurts? Well, there's a reason for that. It's uncomfortable. It shouldn't hurt. Back in the Dickensian days, was brushing their hair 100 times a day. They're onto something, you know what I mean? Long periods of UVA, wear a hat. And if you're a gentleman who's losing their hair, then SPF on your head if you're out working, if you've got a job where you work outside. Now, this is one I did, and this kind of blew me away a little bit. And this kind of is the entire essence of what I've been telling you for the last half an hour. This particular client came to me before Christmas, and she blew me away. Actually, she was lovely. but her hair had thinned. It hadn't particularly got thinner in specific areas, it just thinned everywhere. She showed me photographs. She used to have a massively thick head of hair. So I went through all of the protocols, right, all the different things. What's going on, what's going on, what's going on? Well, she's had hormone testing, it was fine. She took drugs, didn't work. She had a hair transplant, whoever did that to her anyway. She had a hair transplant, it fell out within 6 months. She's done everything, even down to nutrition. Nothing was working. So I think what I might, you know, in my limited experience in this, it's difficult. I'm like, it's got to be hormonal. It's got to be, you know, I can't understand how it could be anything different. Then she said, well, I've got 2 siblings who have exactly the same thing. So I got all excited and went, it's hormonal then. It's hereditary hormonal. There's got to be something going on. And then she went, yeah, but one of them's a guy. I'm like, oh, good God. So that would change the ballpark completely. So I was like, I have no idea. I literally have no idea. And I said that, total honesty. I mean, look, this is the only thing that I could think would possibly work, is there's obviously something systemic happening here that would be related to, you know, maybe health, maybe nutrition. So superficial application of anything isn't really going to work for you. We need to get your health back of your scalp. So let's see what's going to happen, and let's see if we can get it. It'll take a couple of treatments to see if anything's going to happen. And she said, because I was so honest, she was prepared to do it, and she did. And this has never happened to me before, but I saw a difference in treatment 1. Now, if you can see those images, the before treatment on the left-hand side to the second treatment on the right, I can see the difference in the scalp integrity in all 3 pictures on the right. In the first 2, the scalp is tight. It's almost like a drum. On the right-hand side, it's not. It starts to calm down. You can see more sebum coming through. You can see that the hair structure, you can see the small hairs that are starting to come through. I was beside myself. And I was shocked, to be honest. She came to me afterwards and said, I don't want to like tempt fate here, but I really think it's worked. I'm like, oh God, you know, I'm not sure, let's have a look. And of course, with the visual application, I could see it had. So now she's prepared to go on and continue this for the next, you know, 6 to 8 treatments, because she's seeing a difference. And then we can start addressing after the fact. So do I know what caused her hair loss? No, I really don't. Again, we don't have to be honest, but what I'm doing is I'm implanting that product into her skin, which is going to make, or scalp, which is going to make her ecosystem, or that amazing part of the extracellular matrix, just extremely happy. And one of those vitamins, or glutathione, would have helped kickstart that and maintain that blood flow to the follicle beautifully. These are some images from the study. These are 9 sessions. That one's 9 sessions. The next one is 6, and the next one is 6 too. So you can see these are all, the hair is starting to grow back slowly, but we're talking 6 sessions here. It's not a huge amount of time. And if you start to see it, if the patient starts to see a difference, then they're going to continue. That's it. I hope that was informative. If you have questions, which I'm sure you have, Rebecca can shout them out to me now.
Sorry, just unmuting myself. Can you hear me now?
I can hear you, yeah.
Fabulous. Okay, let's see if I can get my camera moving as well. Oh gosh, I just want to put my camera up for some reason. Sorry, 2 seconds. I've got loads of pictures, by the way. Sorry, loads of questions for you, Andrew. So I hope you're sitting.
Don't make them too difficult.
Okay, I'll see what I can do. Okay, so one of the first questions that came in earlier was, is this suitable for people that have had melanoma of the scalp?
Yeah, it's not going to make any difference.
Yeah, okay. Lots of people are asking what camera you've used to take those images. Is there a particular camera that you've got that you'd recommend?
I knew someone was going to say that.
Perhaps we can research that and
let me get back to you on that one. It's in the garage in lockdown. But I'll get that information, send it over to you.
Okay. Somebody else is asking, possibly slightly off topic, but what's your opinion of biotin increasing active acne?
I can't see why it would increase it, to be honest. It's difficult because it is like the skin and hair and nail drug, isn't it? You know, it is a vitamin, or, you know, an amino. Oh, it's not an amino acid; it's a vitamin. If that does happen when you're taking it, then stop taking it. It does tend to have a tendency to work with oil production, whether positive or negative. So I wouldn't actually say it was a specific drug if someone, or product for someone who actually has acne. If they have acne, or it's part of who they are, then I wouldn't take it, really. That's a good question, though. I need to look into that a little bit more.
Okie dokie. Well, we've got notes of all these, so if there's anything that stumps us, we're more than happy to come back to you. Would you recommend a laser cap?
Can't see why not. As long as it has the same depth penetration. I mean, they're quite big at the moment, aren't they? Laser caps. And I think there's some good evidence behind them. It's not going to make it, it's not going to hurt. I'll tell you that, it's not going to hurt. It can only help.
Okie dokie. And if you're doing a 5mm roller microneedling treatment on the scalp, would you use a topical aesthetic first?
Never. You know, those that know me, I've got a thing about topical anesthesia. Topical anesthetic is a vasoconstrictor, so it removes the blood supply to help lessen the pain. And the one thing we need in aesthetics, especially in hair loss, is blood. So 5mm is not going to hurt. It really isn't. I mean, guys are whingers, aren't they? They cry at anything. Just deal with it. Just tell them to bite on something. It's not like back in the day where you were ripping the hell out of the face or the scalp. This is very superficial. You will get blood because it's a scalp, but it shouldn't hurt. It really shouldn't hurt. And also, if they do have a problem with the roller and they're like, oh my God, I can't handle it, then the nano needle does not hurt at all. It literally does not hurt at all. It's more of a trick to it because it's such a tiny, tiny needle. So you'd need to get trained on how to use it. But you can do the whole head very, very quickly. And that's what I used on that lady because she, I didn't want to hurt her. And I thought she was a bit nervous about, you know, using the roller. It scared her a bit. So it's lovely that I had the option to use the nano needle, and I did the whole head in 10 minutes, 15 minutes.
That's great. That's really great. And a couple of other people have actually asked about dermapen. Could we use a dermapen or a microneedling device to carry out treatment?
Yes, absolutely. Yes, of course you can. The only difference is you need to be a little bit more careful with them because the fact that the needle going so fast, sometimes it can catch on the hair, but it's not a negative. I would just tend to maybe part the hair and do it, part it, do it, part it, do it. Whereas the roller, you can just, it doesn't kind of get caught up. But yes, of course you can use that, yeah.
Okay, so from the microtrauma invoked and placement of the NCTF, is there a phase of sudden increased loss as well as prior to visible improvement?
No. Is the answer to that? No, it wouldn't, because the hair's going to fall out. The hair's going to fall out. You know, you can't. It's not going to force it into that phase. No.
Okay. Somebody else is asking, what further training do I require to use the NanoSoft, please? I'm assuming this is probably somebody that's already got a level 4 in possibly microneedling or mesotherapy.
It depends what you're doing now. You can use it it's a mesotherapy protocol, definitely. So FILLMED do a training. As long as you have a level 3 in beauty, we can teach you how to use the NanoSoft. It would be a good idea to understand the philosophy behind mesotherapy, because one of the protocols is hair, as well as, you know, all the others. I do one of those, which is a level 4 upgrade, but we can also do it through FILLMED and teach you the basics of meso in relationship to how to use the nano needle.
Okay. Somebody else is asking, I'm actually going to combine 2 questions in one here. So what was the depth of stimulation and how far apart should the injection sites be?
Oh, good question. With the NanoSoft, it's 0.6 mil. So it's in aesthetics, it's technically touching the epidermal junction. So that means it's going to flood the extracellular matrix perfectly. With the roller, it's usually around the 0.5 is the best one. So still the same thing, you're creating the channels to flood that. And if you're doing it via injection, 3/4 of an inch to an inch apart, because it floods.
Okay. And somebody else has asked, does the NanoSoft work to various depths?
No, no. That's the good thing about it. It was created to, how do I put it? So they did lots and lots of evidence-based studies, must have cost them a fortune to figure out the exact depth of implantation of a product to help skin health. We all kind of know it's epidermal junction, but we need, evidence of that. So 0.6 was what they came up with, is the absolute perfect depth. It's not too superficial, it's not too deep. We don't want to break the epidermal junction when we're dealing with rejuvenation, because we want to kickstart the epidermal and keratinocyte growth factors, which sit in the epidermis, not in the dermis, and they're like the band leader for all of the growth factors. So no, it sits exactly that depth.
Brilliant. Okay, we've got a hell of a lot of questions coming through, Andrew, just to warn you. I've got one from on a WhatsApp saying, what would you apply post-treatment? What home care could you recommend?
Yeah, that's actually a really good question. I would definitely bin anything from Tesco shampoos. It will be, if someone is concerned about this, then they need to go out and do a little bit of research. I mean, there's caffeine shampoo. I've never used any of these things, but they have quite a lot of evidence. Go to your hairdresser, who may have a shampoo that is stimulating. Not the what's that one for dandruff?
Not Vidal. Is it Vidalcicil or?
No, I've forgotten. My name. It's just gone. It's like really famous. But the one for hair loss that everyone's used, don't use that. Oh. Just something that's very, very soothing, very calming. Nothing that's full of oil. So Head and Shoulders. Thank you, Lorraine.
Yeah.
That stuff will take your enamel off. Just something that's it's the same thing with skin. If you're dealing with acne skin, the last thing you want to do is overstimulate it. So shampoos and things like that, I would something really calming so that it doesn't fill the follicles with oils and lotions and potions. I would then tend to go and use something, and a lot of good companies will have a product that's a stimulation, but it's usually has an alcohol base, so it disappears, and it's watery. So you just put it on after you've shampooed. That'll maintain a stimulation. So we do need to, the client does need to do certain things at home. Or like I said, the best of all of them is a paddle brush, a squishy paddle brush, £5 from Tesco, and just really go for gold.
Yeah, so I guess would you also advise maybe avoiding shampoos with like parabens, sulfates, all that kind of, silicone?
Yeah, of course. Yeah, all of those things, yeah.
Okay, great, okay. So maybe going to like a professional outlet like Sally's Beauty or something like that might be a good.
Yeah, yeah, exactly.
Okay, can I do this treatment post chemo? How long should I wait, and what sort of protocol would I follow?
Okay, with anything to do with chemotherapy, you'd need to speak to your oncologist on that one. There's nothing that it can do really, and I'm sure that they would say yes, of course, go ahead. But with chemotherapy, so much is happening in your body, especially in relationship to blood as well. I would leave it until that's over. But that's a really difficult one. But ethically, you'd need to speak to an oncologist to make sure that everything's okay and he signs off or she signs off.
Yeah. Okay. Would you recommend using the light peel before starting?
Why not? That's actually a very good idea. Yeah. Might be a little bit messy, but depends. If it's a guy, then yeah, because they have the short hair.
Yeah.
I mean, if you look like those pictures, I should get some. If you look at someone's scalp who really has no maintenance, it's like the surface of the moon, and it scares them to death. Actually, it's really cool for them to see it, like how quite gross it is, all of the oil and the tissue, the skin, and everything else. It's going to clean that up. So yes, absolutely, I think it's a very good idea.
Brilliant. And
Well
what
done,
about,
whoever said that.
sorry?
Well done, whoever said that.
Yeah, even Jack, well done to you. Okay, so what about PRP? So can this be used in combination with PRP? If so, would you do it in the same visit? So I guess they're talking about, would you actually combine NCTF with PRP?
Well, as you probably know, PRP is off-label now for everything that's mixed with it. You can't mix anymore, and you wouldn't really need to. Again, this is slightly difficult if it's trauma-related hair loss, which is where the PRP sits. You can use it on its own. I would combine though. If you've got great results with PRP, continue using it, but it does only have one growth factor. It does kickstart other things, of course, but with NCTF, it's got everything. So you can combine the two, but it would have to be separate injection. To be honest with you, if you're doing a needling or even nano, you know the vascular activity of the scalp, it bleeds crazily. So by bleeding is kickstarting its own PRP anyway. So you're kind of getting a bit of best of both worlds.
Nice.
Yes,
nice.
in combination.
So yes. What sort of cost would this, how much would you be looking to charge for one session?
That's a good question too, because it's obviously going to be a lot cheaper than PRP because you haven't got to do all the blood taking and spinny, stabby. Is much less time frame. People averaging around maybe 100 to 150 pounds because it really doesn't take that long.
Sorry, I got distracted by another question coming on the WhatsApp. When would you use LED in this process? Before, after each session? How would you do it?
Directly after. Okay. You just injection, roller, whatever. Don't clean the scalp. People get confused on that one. Leave it all on there. Blood, excess fluid, whatever. Leave it. Apply it. Put the LED as close to the head as possible on red, of course, and leave it.
Okay, and how many vials would you use in a full scalp treatment?
It's much less with needling than it is with an injection, but maybe 2 for the whole head. If you're doing the whole head, if you're just doing partial, 1.
Okay, so I've got 2 people asking sort of fairly similar questions. So why would you use a 5mm roller and only 0.6mm nano needle? And what should be the correct injection depth?
Oh, okay. The correct injection depth is just above the stratum, the epidermal junction, basically. So it's just it's a different implantation method, and it's your choice which one to use. It's not technically about depth. 0.5 is perfect because you're in deep enough for the product to go down slightly less, so it will hit the 0.6. Below 0.6, you've broken the epidermal junction. Really, you want to kickstart all of that goodness. I mean, the old school of thought was about 4 mil, which basically went very, very deep. It was incredibly painful, and the results have been very similar between the very deeper injections and the superficial, because we're not talking about targeting the hair here, even though we technically are. We're targeting the extracellular matrix which doesn't sit down there. So the 0.5, to answer your question, 0.5 is perfectly fine, because it's not far off. 0.5 to 0.6.
Okay, somebody's asking about, would you mix anything else with NCTF? So any other actives, for example, and then if so, how many in between? So I don't know if they're talking about specifically mixing it directly in the same treatment, or perhaps using a protocol where they use NCTF but then something else, then NCTF, then something else.
Okay, no. NCTF's got it all in. You don't need to mix anything else. The only one we just touched on was PRP. There's a possibility there because there's obviously clinical evidence behind that. But you could use it in the same treatment, but you would not mix it together. You don't need to mix NCTF with anything else.
Okay. Somebody else is saying, I don't have level 3, so does that mean I can't do any training with FILLMED?
If you speak to me, I can find out what your background is, and we can get you to level 3 and the various in certain practices that you want to do. You don't actually need to sit the whole level 3 because it's basically machinery, isn't it? But if you have maybe level 2, which is important because it's A&P, I can upgrade your A&P and then take you into a level 3 or level 4 in specific genres, it's specific protocols, not a whole. And the beauty industry has changed quite dramatically now, as I'm sure you're aware. You don't necessarily have to go through the whole 3 years. As long as you have your basics of understanding, you can be fast-tracked in different variables, as long as you have the education is accredited correctly and insured. But if you give Rebecca your details, I can talk to you about that.
Brilliant, thank you, Andrew. Viviscal shampoo and tablets, would you recommend them? And how long after the treatments would you recommend to wash the scalp? So after they've had this treatment, how long after would you wash their hair?
If they can handle it the next day. Viviscal, I don't know masses about, to be honest with you, but I have heard some amazing things. I did meet a girl who worked for them, and she did tell me some of the trials that are going along with it. Yes, absolutely. I mean, you can give them that. That is a product they can buy, of course, and obviously the shampoo is related to hair loss, so that makes perfect sense. You can also give them biotin. They can go to their local Boots and buy biotin as well. So anything that's going to help.
So I guess that's working from the inside out again.
Yeah.
Would you recommend disinfecting the area beforehand?
Oh, I'm sorry. Yeah, of course.
Yeah. And would you ask them to wash their hair in advance? Would you, ask them to perhaps come in with clean hair, or does it matter?
I would, just in case you don't wash them. You never know.
Just nicer, isn't it? I've got a few more people asking about NCTF and PRP mixing. Hopefully we've answered that question for you. If you feel like we haven't, pop another question in at the bottom now. How many vials on average? We've got that one as well. Could you just repeat the cost you would recommend to charge per session? And I know this is quite a difficult one because it's going to be different amounts of sessions per patient depending on their indication, etc. But a rough average of what you imagine a cost per treatment would look like, if please you could.
Averages, again, it's where you're living, parts of the country, etc., etc. But averaging between 100 and 150.
Okay. And then somebody else has just asked, how long would you actually leave the LED on for as well?
20 minutes.
20 minutes one. Okay. I'm just going to check I've got no more questions that have come over on here. Okay. Yeah, we've basically covered everything that's coming on there as well. Okay, fair enough. Thank you very much, Andrew. I'm just going to run a couple of slides myself now just to show you the training that we've got coming up for the rest of the week. If I can find it, bear with me a second. But thank you, Andrew. Is there anything else you want to add, Andrew? Definitely got no more questions coming in.
Brilliant. Well, if you do have any questions, you can contact me or Rebecca, and I'll answer them, of course. I mean, it is a really big subject, isn't it? I totally understand that, and it's getting to the point of understanding it and being able to treat the client ethically and honestly. That's really it.
Somebody else has just come in at Andrew, and they've just asked, everybody's saying thank you now. Appreciate your thanks. Thank you, guys. Can we apply intradermal with a 4mm syringe, an insulin syringe?
Yes. It's going to be a lot more uncomfortable for the poor person. But yes, you can.
Okay, fantastic. Thank you very much. Okay, that covers that off. Okay, like I said, I'm just going to cover a couple more slides with you guys. That's just literally to show you the training we've got on for the rest of the week, and also what's coming out of our global support as well. So if you just give me 2 ticks, I won't take up any more of your morning after this. Unfortunately, there's no sunshine down in Essex. So this week we've got Wednesday, we've got Andrew on. It's a busy week for Andrew, actually. He's got skin perfusion on Wednesday. I'm going to be joining him and sort of co-hosting that session with him just to get to the to get to grips a little bit more with our unsung hero skin perfusion, with medical grade active ingredients and clinical studies behind those products as well, and the benefits of obviously being able to use them at home and talk to your patients about them at home while your businesses are closed. And then we've got a nanosoft microneedling and mesotherapy session on Friday with Andrew, and we've got Debbie Rainbow, our nurse practitioner, joining us for that one as well. And then Monday we've got why choose art filler specifically for our medical professionals, so hopefully you can join us on that one. Now we've also got FILLMED.com, which is run by head office, which is in Paris. This is their website, and this is how you can join the webinar sessions that they are doing. These are all led towards medical practitioners for injectables, but we've got the 14th and 15th this week where we're talking lip anatomy, and also actually a bit more about art filler itself as well. So thank you very much for joining us. I say happy Easter. It's sort of enjoy your last day of Easter, and thanks again, Andrew. Bye guys.
Who are you? Calling me. You're not far.